soon as I got into the air-conditioned van, I cooled off, I got some water, and very quickly I felt better. So I felt fine, but I'm now taking my doctor's advice, which was given to me on Friday that I ignored, to just take some time to get over pneumonia completely.
Hillary Clinton says it's just pneumonia, and she did not think her diagnosis was a big deal. But with the way the campaign has handled this situation so far, should we be looking more closely at her past medical records? Let's talk to Dr. Devi Nampiaparampil. She is a clinical associate professor at the NYU School of Medicine. Good morning to you, Doctor.
Good to see you.
Nice to see you again. This is all anybody's talking about. She says she has pneumonia. She knew it on Friday, didn't tell anybody. What do you think?
I think she probably has pneumonia. I mean, the doctor also said that it explains some of the symptoms. So you could get dehydrated from pneumonia for a few different reasons. Your blood pressure could drop and you could get dizzy or lose your balance, even lose consciousness. Basically, if you're not taking in as many fluids, if you're burning up more fluids because you're fighting an infection, if you have less oxygen in the blood, and maybe even with antibiotics, if you're nauseated and vomiting, all of those things can cause your blood pressure to drop.
Sure. I think a lot of people feel the same way. She probably does have pneumonia, but they wonder whether or not there's something else. There's some other underlying condition or something else we just don't know about, and she's not going to tell us.
Sure. So I'm not treating her, but normally in a doctor-patient relationship, you know, the patient tells you all the different symptoms, right? They're trying to get treated, diagnosed, and treated. And this is a little difficult because we don't necessarily know all the symptoms. I mean, at first they said overheating, so some of this is
that turned out that wasn't true. But as it turns out, Dr. Oz is going to be reviewing Donald Trump's, some of his records on his Thursday telecast. And then Hillary Clinton announced that she's going to be releasing more medical records. What do we need to see from the candidates, both of them?
So I think, you know, just like with any job, right, we have to see if they can perform the job function.
Sure.
So normally, let's say if I was evaluating an injured worker or somebody with disability, right, we think about what are the job functions and then test them for that.
Right.
So in terms of, let's say, disability versus death,
Sure.
I mean, in that age group, you look at things like cardiovascular fitness.
Sure. And Hillary has had a concussion in the past with a blood clot in her head, so maybe a neurologist should weigh in on her condition?
I think it's reasonable for a neurologist, I mean, neurosurgeon, somebody with special expertise in that area to take a look. I mean, I think she has had that in the past, but the issue is sometimes, I mean, personally, I think an independent medical evaluation might be helpful for both candidates.
Just like what happened with John McCain back in 2008. He had 1,000 pages of documents.
Exactly.
All right. Dr. Devi,
Nice
thank you very much.
to see you.
Nice to see you.